We have all been there. You bump your head, maybe on a cabinet door or during a fall, and while it might sting, you usually brush it off. But what if that headache that follows is more than just a passing ache? How can you tell the difference between a minor bump and something that needs urgent attention? When you experience a headache after hitting your head, certain warning signs, known as red flags, indicate that you should seek immediate medical attention. These red flags suggest a potentially serious injury that requires professional evaluation. The brain is encased within the skull, and a sudden impact can cause it to move rapidly, potentially leading to bruising, swelling, or even bleeding inside the skull. These internal injuries can increase pressure on the brain, leading to symptoms that worsen over time and can be life-threatening if left untreated. Ignoring these signals could delay crucial treatment for conditions such as a concussion, a brain hemorrhage, or a skull fracture. To protect your health, you should immediately go to an emergency room if your headache steadily worsens, or if you experience repeated vomiting, unusual weakness or numbness on one side of your body, or difficulty speaking. Seek help right away if you notice any changes in your vision, such as blurry or double vision, or if you feel extremely dizzy, confused, or have trouble staying awake. Additionally, if the head injury caused you to lose consciousness, even for a brief moment, it is essential to get medical care promptly. Doctors will often perform a neurological examination, checking your reflexes, balance, and cognitive function. Depending on their findings, they may order imaging tests like a computerized tomography or CT scan, which quickly shows detailed images of your brain and skull to detect bleeding or fractures. They can also look for signs of a subdural hematoma, which is bleeding between the brain and its outer covering, or an epidural hematoma, which is bleeding between the brain covering and the skull. By recognizing these red flags and acting quickly, you empower yourself to make informed decisions for your well-being. Early medical assessment ensures that any serious underlying injury is diagnosed and treated promptly, helping to prevent long-term complications and support a smoother, safer recovery from a head injury.